As a continuation to our topic last meeting, we will now move to sports injury prevention. Now, we have the topic number 1. Adopt a comprehensive training program. Comprehensive training program goes beyond addressing those fitness parameters such as aerobic capacity and strength. It is a holistic program that suits an individual's needs and demands. The individual must first assess the weakness and abnormality of his or her movements and fitness to be able to customize his or her training program. It is very important that we individual should identify the weaknesses in our body for us to improve it. The purpose of training program is that if we already identified our weakness in our body, then that's the time for us to choose a specific and appropriate training program to develop it. For example, if you identify that you lack a cardiovascular endurance, then that's the time for you to seek or to choose appropriate training program that can develop your cardiovascular endurance. Number one solution for that, or number one training program to enhance your cardiovascular endurance, is jogging. Now we have the topic number 2. Use protective equipment and practice correct technique. Individuals derive fun from playing sports and other physical activities that they sometimes forget to wear proper protective gears. Injuries while playing a sport or game can be prevented by using some protective equipment. It is very important for us to use protective equipment and practice correct technique for us to prevent ourselves in getting an injury. For example, if we engage into sport volleyball, some of the players, as you observe, wears knee pads for them to protect their knees. If we engage ourselves in exercises at the gym, as you observe, there's a gym instructor for us to correct our execution and to give us a proper technique in doing such exercise, because doing a wrong posture or wrong technique can lead us into a serious injury. Topic number 3. Incorporate recovery strategies in the training program. Training and exercise is a controlled form of stress that stimulates the body to become stronger. Recovery provides the body time to rebuild broken musculoskeletal structure. We are not required to train at the gym every day, because if you can remember my topic in week 1, we should have preferably 2 days of recovery for our muscles to recover from muscle tears and to condition again our muscles to specific vigorous activities after a recovery day. Because if we continue to give stress on our muscle, that can cause muscle tear without recovery, then we are putting ourselves into danger, because there's a tendency that we can get a serious injury because of it. Topic number 4. Follow rules on decorum competition. Tournaments and sports officials draw up rules and regulations for any competition to maintain fairness and safety for everyone involved. These rules should be strictly enforced to prevent excessive physical contact that might lead to injuries. It is important to practice sportsmanship and to resolve conflict without resulting to violence. Just like in dance sport, there are a lot of couples dancing in one dance floor, wherein there's a rules that you should not get bumped to other couples if you are one of the couples, because you might get disqualified. The purpose of this rule is for the dancers to carefully move along the dance floor by not hitting others, for them to avoid themselves in getting an injury. Fitness and training injuries can be prevented if an individual takes the necessary preparations and precautions on the following variables. So the first one is wearing a proper attire. The attire should be appropriate for the chosen activity. It is important to consider comfort and protective when choosing appropriate attire. A special attention should be given when choosing footwear because many chronic injuries are caused by inappropriate shoes. A good pair of shoes will provide stability, support, cushion, and comfort. For example, in football, they are required to have a spiky shoes wherein it do not fit to basketball player because basketball plays on a cemented floor, unlike on football that they require spikes for them to grasp their feet to the ground for them not to get slipped. Next, we have proper technique. An individual need to consult a trainer and ask for proper instruction in performing the chosen activity or exercise. The knowledge on how to execute the movement is just as important as the movement. The benefit of the exercise will be compromised if it is not performed with the correct technique. That's the reason why we have coaches in different sports for us to be guided and to give us a technique in executing proper executions for us not to get ourselves an injury or can cause long-term injury. Next, we have the gym etiquette. First, we have ask for a spotter when lifting loads. One repetition maximum can be used for determining an individual's maximum strength and is the method for determining the winner in events such as powerlifting and weightlifting competitions. Second, do not drop the barbell at the end of the set. Put weights and dumbbells on designed racks. Be aware of the exercises area for each equipment. Do not use mobile phone inside the gym. Next, on a track, inner lane is for walking while outer lane is for running. Do not engage in horseplay nor talk in a loud voice. Do not wear loose jewelry while working out. This is very self-explanatory in which we should always remember these safety precautions for us not to get a serious and long-term injury. Next, we have proper environmental condition. It is advisable to check the environmental condition before the exercise session. The area in doing such exercises or vigorous exercises should be ventilated for us not to suffocate and to have more and efficient oxygen for us to breathe in. Next, we have the adequate recovery. The recovery period is just as important to provide the body with an adequate and proper nutrition to recover. Many chronic injuries occur because the workload was too hard or it was performed too soon. That's the importance of adequate recovery. Like for example, after doing a vigorous or even just a simple exercise or training program, lastly, we should do some cool downs for our musculoskeletal to be recovered because of the exercises we made to prevent ourselves in getting an injury. As soon as possible after an injury such as a knee or ankle sprain, you can relieve pain and swelling and promote healing and flexibility with the rise or the rest, ice, compression, and elevation process. You can see in this infographic the meaning of rise. Now this is the rise method. First, the R, which is the rest. Stop activity that might worsen the pain. Second is the I or ice. Wrap an ice pack in a cloth. Apply the ice pack to the injury to prevent swelling. Next, the C, compression. Wrap the area with an elastic bandage. And lastly, the letter E, or the elevate. Keep the injured area above your heart level to minimize swelling. The first method is rest. Rest and protect the injured or sore area. Stop, change, or take a break from any activity that may be causing your pain or soreness. Next, the ice. Cold will reduce pain and swelling. Apply an ice or cold pack right away to prevent or minimize swelling. Apply the ice or cold pack for 10 to 20 minutes, 3 or more times a day. After 48 to 72 hours, if swelling is gone, apply heat to the area that hurts. Do not apply ice or heat directly to the skin. Place a towel over the cold or heat pack before applying it to the skin. Next is the compression. Compression or wrapping the injured or sore area with an elastic bandage, such as an ACE wrap, will help decrease swelling. Don't wrap it too tightly, because this can cause more swelling below the affected area. Loosen the bandage if it gets too tight. Signs that the bandage is too tight include numbness, tingling, increased pain, coolness, or swelling in the area below the bandage. Talk to your doctor if you think you need to use a wrap for longer than 48 to 72 hours. A more serious problem may be present. Next, we have the elevation. Elevate the injured or sore area on pillows while applying ice, and anytime you are sitting or lying down. Try to keep the area at or above the level of your heart to help minimize swelling. Rest stops new injury and bleeding. Ice eases pain and reduces inflammation by constructing the blood vessels. Compression and elevation limit the amount of swelling and fluid accumulation around the injured area. I will be having here a sample videos on applying Rice method to the injured arms, knees, and ankles.
Applying an elastic bandage to an ankle for swelling control. Place the loose end of the bandage underneath the foot, come around and catch it with the rest of it. Go up around the ankle. As you come around, apply a moderate amount of stretch to the elastic bandage. Cross the heel, come around the front, cross the heel on the opposite side. When you come around the front again, go around the point of the heel to hold that in place. And then apply the elastic bandage to the ankle and lower part of the lower leg. And apply your fixation.
Begin wrapping around the leg at mid-calf level and circle the leg a few times. Wrap bandage diagonally up behind the knee and then around the leg above the knee joint. Continue wrapping behind knee diagonally, creating a figure 8. Repeat this several times. Finish wrapping around the leg above the knees several times. Secure the bandage with the elastic clips, or, if using the self-adhering bandage, by smoothing down the end.
Technique for support. First, you're going to want to anchor just below the fingers. That way they still have full mobility of each finger. You don't want to take away any function there. As you change your direction, you don't want to pass between the thumb and the first finger more than 2 or 3 times, because it begins to get bulky right here and limit how much thumb adduction they're capable of achieving. Once you cross the wrist joint, you can move out of the figure 8 pattern and into more of a spiral pattern, which is appropriate for wrapping the long bone. And secure with a piece of tape. And just make sure that they have full function of the fingers. Go ahead and make a fist and back out. How's that feel? And of course, check for capillary refill. You can press the nail bed and just make sure that they have good blood.
Analyze your performance by pair. Perform the RICE method. Then apply bandaging method to strained ankle, strained wrist, and strained knees. Video your performance and upload it to the provided Google Drive.